Hey, welcome to the Self-Help Doctor podcast. I'm Dr. Ohad, your host. And with me today is Batel Magen, a
That's right.
therapist from London, creative movement therapy, right? And supervisor. And we should probably give a little bit background on how we know each other. I actually know Batel from high school.
Mm,
Almost 30 years ago. I won't say exactly how long ago because I don't want to age anyone here, but from a long time ago,
yeah.
right? And interestingly, we have each other on Facebook, but we haven't really spoken much or been up to date, just kind of seeing each other maybe occasionally on Facebook. And that's it really. And then when I was looking for a guest for the podcast, you popped up. And so we got to maybe catch up a little bit, but interestingly, yeah, I mean that's the background here. So,
Yeah.
oh, yeah,
Yeah. It's nice to get in touch, though. It's nice that we can get back in touch through our professions.
yeah. I have to admit it was strange talking to you for the first time because when I knew you in high school, you didn't have a British accent,
Wow.
and then you moved to London, and now you got a bit of an accent, and so now
Yeah.
it's like the person I remember in my head is not really
Yeah.
what I'm hearing now.
Yeah.
So,
I mean, I've been here for 20 years, so
yeah.
it's rubbed off on me over the years.
Yeah, I just hope I understand all the slang.
I'll do my best.
I have family there, so when I went to visit them and hung out with my cousins, there was a lot of slang I didn't understand, and I
Okay.
almost got run over because I looked the wrong way when I was
Yeah.
trying to
Yes.
cross the
That's
street.
pretty cool. Yeah.
So we got to catch up a little bit, and I know that that you work mostly with adolescents,
Mhm.
and you do a lot of creative movement therapy, which uh, which I do know that you do dance from the Facebook. So that makes sense to me. But why don't you tell us a little bit more about what you're doing these days?
Yeah. So I am still a dance artist. I do a lot of kind of dance theater work more. I did develop my own dance theater company, but as my family grew, I've had to kind of put that a little bit on pause. But I do a lot of dance technique and I teach contemporary dance. That's kind of my main dance uh, um, technique that I use or that I enjoy. So that's still there. And I'm glad it is because it gives me a lot of self-expression,
Oh,
helps
yeah,
me express my energy because I have a lot of energy
yeah.
in the studio.
Did I did I tell you that that I also dance?
Yeah, you do salsa, right? Or Latin
Yeah, I
American?
used to do salsa. Now these days, kizomba and bachata, and I totally agree with what you're saying because uh, it's like a wordless language that's
Yeah.
universal. So
Mm,
as and you can probably relate to this, being someone between languages and between cultures,
yeah,
something really universal about dance. And
yeah,
when me and my wife always travel to dance festivals abroad, it's like it doesn't matter what country and what language they speak, and if we can actually talk verbally to each other, and that there's always a
right.
connection through the dance.
Yeah, that's right.
I think
And
you have
also, there's something about the acceptance, especially kind of in contemporary dance, where it's okay to kind of roll on the floor and throw yourself in the air, and it's all very there's a very set technique and there's a lot of form to it, but within the form it's totally acceptable and actually encouraged to kind of really be as physical and use up as much space as possible. And that's kind of almost contradiction to generally in life we kind of tend to take up less space, don't we, and have less of a permission to go into that realm of
right.
physical.
You're saying a lot less rules for what's right and wrong and acceptable and not, and you should just feel free to be yourself no matter
Yeah,
how
that's
weird
it.
or different. Yeah, I love that.
Yeah. Yeah, that's right. So, but that area of mine is still kind of bumbling along. And then my psychotherapy area is in creative movement psychotherapy, like you said. And that is also a great form of expression. It's different, but it's still using the body. You know, when I do work with young people. That's my predominant demographic in terms of clients. And yeah, we do a lot of verbal and nonverbal, but the main thing that I think maybe distinguishes is that there's an acceptance of the body as a second, you know, as a main focus, but not necessarily to the point where it becomes intrusive, but just kind of allowing that bit of us to be present. And also the idea of creative expression in however way that comes up, through art, through making music, through whatever, being still, doing role play. That's another big part of my work with them. Yeah, and both of those worlds, actually, the dance artist and the creative movement psychotherapist, they work really well together. I kind of overlap.
Oh, yeah, they're very complementary.
Yeah.
I mean, I would think, you know, a lot of times, and again, maybe I'm just saying this as someone who grew up in between languages and never felt that I mastered any particular language, that sometimes you're at a loss of words to express your emotions. So obviously part of it is, first of all, allowing yourself to express them, but the other channel is, do you have the words to express yourself? And there's something about movement and physical expression which isn't limited by a language, that allows you to just let it out in any way, and there's no right and wrong. Like creative, artistic, music, dance, all these different artistic channels that just allow you, without any rules, to just let it out, which must be great for adolescents who don't always know how to put their feelings into words, or maybe they grew up in an environment that didn't encourage it, and they're not comfortable doing so. And so I would imagine that gives them that room.
Actually, developmentally, adolescents are at their peak of creativity. So when they're being, you know, when there's that kind of permission to let them find their way to express themselves creatively. I mean, it's not easy. The young people I work with are young people that struggle with quite severe mental health challenges. And so there's a lot of layering to kind of have to decipher and dig through. But the whole time we do that, there's an acknowledgement that there's a body there. So there's something about just being aware that there's things in the body that we don't necessarily give permission or even know are kind of there to give us information or to help us express ourselves. So there's something just by kind of naming that, sometimes it brings another dimension to the session, and sometimes not, you know, because it's really exposing, isn't it? We're so kind of constrained by society.
But you're giving a new definition maybe to what that emotion is, that it's also something in their body that they might be feeling physically and they didn't identify as emotion. I don't do dance therapy, but I can completely relate to the idea that that patients bring in stress and symptoms through their bodies, and they're not recognizing it or identifying it as stress. You know, in fact, they're identifying it as a problem that they want to resolve, and just to the fact that they're judging it and scared of these symptoms, they're actually causing more stress and more symptoms and exacerbating the very problem that they're trying to solve.
That's right. Yeah, that's it. So yeah, there's something really pure about it, but also there's something that I have to always be quite aware of, you know, really gentle and really sensitive about what that can bring with it, because it can bring a lot of shame and guilt and, you know, built up emotions or traumatic experiences maybe that have really been pushed down, and literally pushed down into our deep parts of us. So yeah, so the work that I do sometimes it's so kind of delicate and small little kind of changes or kind of moments that we experience together, like that feel small but actually generate quite a big shift. Bottom up, that's kind of my main model, is bottom up therapy. Saying that, there's a lot of talking. I love talking. I mean, I love language and words and talking. So we do both.
Talking like as part of the art, like drama, or talking to talk about the thing that you're trying to feel or express.
Both. Sometimes we spend, out of a 55-minute session, sometimes we would spend 30 minutes kind of chit-chatting.
Yeah.
But while we're chit-chatting, we're lying on the floor, or we're sitting on big physio balls, or we're fidgeting, or we're, walking around the room. So even though we're chit-chatting, so we're quite superficial conversation, on a physical level, we're doing quite a lot of processing. And also we're doing quite a lot of kind of noticing other things, using the space, eye contact, accessing the floor, things like that. And then sometimes we bring them both together. So I would offer my observation, and then we would kind of reflect on that and see what observations they bring, and that kind of leads on to other bits. Right.
Yeah.
So yeah.
I love that freedom that, we have these rules that we're taught, and just like, the environment and the culture of what's right and wrong, even when it comes to our own emotions. And then, like you said, a lot of times there's a lot of shame and fear in just touching or talking about those very emotions. Like there's something dangerous about them. There's something wrong about them. There's something wrong about the way they impact us and affect us. And then when we kind of try to bypass all that cognitive judgment and just touch the emotion in a more raw fashion through art, there's something a lot more freeing. I think I told you that I used to do drama therapy, and I love that. I used to do it with patients, not just outpatients, but also inpatients in a psych unit, and even patients who are severely deficit in their functioning. They not only were they able to do this, they enjoyed it, because it just detached them from the whole, what can I and can't I do, and what should I and should I do. And in fact, it even gave them a sort of excuse to do or say things behind the veneer of behind the safety of, it's just drama, it's just we're just acting. To do things that normally they want to do, but they're afraid to do, or they don't allow themselves to do because of judgment or fear of some sort of consequence. And now there's like, well, if it's just acting, it's not real. Okay, then we can do this stuff, letting out anger, letting out that stress without, trying to hold it in and being frantic and panicking and just playing it out. And through that, they started to realize, maybe I just did it. I mean, it was just pretend, but I did it, and I don't see what the big problem with it is, like maybe this is okay. Maybe it's okay to be angry. It's okay to be frantic. It's okay to be sad. Like maybe this is not such a horrible thing. And so it really helps them kind of bypass some of that judgment. And I think there's not really enough weight or legitimacy or recognition, even among therapists and even among the higher ups that be, about the added value of creative therapies and what they can offer that traditional talk therapy can't.
I mean, just to follow what you just said, there's been recently, if I just take from my recent experiences with the young people I work with, there's been kind of, I do group and one-to-one, and I remember in one of the groups we were doing something. It's all quite spontaneous as well. That's the other bit that's really, I think, is really important, is kind of delving into the unknown. And we were doing something that kind of happened spontaneously in the group. And while one of the male young people there doing it, while we were doing it, kind of I can hear him, but not only him, quite a few of the group went, oh my God, this is so weird. I can't believe I'm doing this. It's so weird. But they kept doing it. So there's something about allowing that expression of verbally, this is odd, but seeing it through and not stopping, because we have that construct in our mind, and allowing us to kind of just be in the moment. And then we saw it through, and it was that kind of idea that this is odd wasn't repeated. And we just allowed kind of whatever came after to come after. And that was a lovely moment of journey and trusting, you know?
Yeah, I think that those comments, this is weird, this is odd, like, what the heck are we doing? I remember that feeling just at the beginning of drama class. And, there's some cognitive dissonance. Like,
Yeah.
wait, what are we doing? Like, this is not what people do. This is not, normal. And yet everyone's in it together and we're all doing it. So I guess maybe it is okay. And then they allow themselves to break that barrier or that rule, which is something that I often challenge my patients to do in CBT. I help them recognize that these rules that they're carrying around with them, and if they can't function according to these rules, then they start feeling stressed or depressed or judging themselves, or lowering their self-esteem. And then I say, wait a second, what happens if we just kind of let ourselves function without these rules that you've been carrying all these years? What happens if you're not always perfect, and you're not always successful in every single thing you do, and you're not always feeling in control or certainty or feeling calm? What happens if we let that happen? And at first it's cognitive dissonance, like, hey doc, what the hell are you talking about? Like, that's horrible. But then we kind of break it down, and there's no clear threat. There's a lot of guessing, but there's no like clear, a singular threat that they can prove is going to happen. So we say, let's check it out. And then I send them off to do all these kind of things that challenge their rules, break that matrix code and just try things differently and find out what happens. And then they come in that next week and they're like, yeah, I'm still alive. Like it wasn't the end of the world. It was uncomfortable there at first, but after a couple of times that I did it, and I think that freedom is something that is not a given for lots of people. They might grow up in a household or a setting where they were taught there's a lot of rules and you've got to do things this way. And if you don't do them this way, something bad is going to happen, or it means something bad about you.
Yeah.
And then we don't have freedom to just explore. Yeah. And when the household says, hey, it's all fine. We all fail. We all get back up. We all try different things. And, it just doesn't always feel good, but it's fine. Then those people are a lot less inclined to develop some sort of emotional issues later. And so sometimes you need to teach them at a later age, whether it's adolescents or me with adults, having them explore that freedom, how catastrophic is it? So
that's right.
I think that's what you're offering them, like a setting where it's safe to explore and to break those rules that they're carrying with them.
Yeah, that's right. And I guess one thing that I really cherish about this type of work that I do is that I'm always doing it with them. I'm always there doing it with them. So there's like there's also a corrective kind of attachment possibility going on there, where I'm not there necessarily to watch, to kind of watch them, or sometimes we do witnessing, but that by choice. But the majority of the time, whatever it is that we decide to do creatively, I join them in my own way. So there's this kind of mutuality, shared lived experience of it, and we kind of see it through together. And that feels really important, especially with young people when they've had insecure or avoidant attachment relationships. It's really important that becomes kind of a fundamental experience alongside the other, you know, building blocks that we're doing. Yeah.
It's a new way of experiencing.
Yes.
I think.
Relationship. Yeah. Yeah. That's
Yeah,
right.
that's
Yeah.
amazing. What kind of, I don't know if there is, but are there certain types of issues that you work with, or is it
Yeah.
just anyone who's got some emotional discomfort or
Well,
difficulty?
I work in a psychiatric unit. So
Okay.
by the time they get to us, they've been through, you know, they've been through a lot of systems and institutions,
Right.
and a lot of it, pandemic wise, there's a lot of repercussions with young people. There's a lot of body image and eating disorders. There's a lot of OCD. Yeah, and I mean, we don't necessarily get a lot of psychosis or acute bipolar. We do sometimes, but that's not regular. And there's a lot of trauma. So trauma informed mental health challenges that derive predominantly from a younger age, you know, quite young. So they kind of would have lived through a lot of severe trauma experiences. And then this would be kind of the outcome. 15, 16, well, actually, we have quite young ones now, 13, 14, yeah. So at 18, they would then be, if they would still be with us, they would then be transferred to adult services, but we try and stop it. We try and get them out of that pathway, obviously to lead to have a lovely, a life, basically, outside of institutions. There's
And
also,
you
go on, sorry.
and you find that this kind of work has been helpful for all those different issues.
I mean, some are more open and accessible to it than others. You know, working with eating disorders is really, really challenging, interesting and challenging at the same time. They have to be in a certain place to access this type of work. So they wouldn't really be, they can access it when they're really, really thin and still in stage 1, which is where they have to be refeeding, basically, where they have to gain weight.
Right.
But I work differently with that kind of population than I would do with, you know, self-harm or suicidal ideation, or because the needs are slightly differently. And also the mindset that these young people present with is quite different according to where their challenges, you know, their mental health challenges. And of course, they work alongside quite a lot of other, you know, they have clinical psychology input, and they have psychiatry input, and they have OT input, you know, so it's all, when it gets to the inpatient, it's quite a big package that they get.
I'd imagine, I don't know, but I'd imagine that some issues have more of a tendency of a need for control than others. So I would imagine that for those populations, for example, in anorexia, in OCD, these are disorders where classically there's a large need for control. And then I would imagine that for that kind of population, it would be more challenging for them to let go and let them experience themselves through the creative movement, and let go of all the rules and the judgment that they've learned to use.
Yeah, that's right.
Yeah.
That's right. But there's a kind of innate fundamental need for creative expression. So even though it might be layered with all of that need for control, underneath it all, there's also really there's a person that has that ability to access that. So it's kind of finding my way in with them. So again, it's a joint dance, I call it, because I have to, because I work from a person-centered, predominantly person-centered kind of approach, and really about kind of being with the person in front of me. And even though there's a lot of control in their thoughts or in their kind of cognitions, there's also a willingness. Most of the young people are really willing to give it a go and see what happens. They're kind of intrigued a little bit to see what is this all about? You know, God, okay, I've never done this before. What are we going to do? What's this all about? And I think because there's no right way of doing it, there's kind of we kind of build it together from scratch. I think there's something really simple and accessible in that approach from my work. You know, there's no necessarily a model. There's a lot of technique that I have in the background.
Could you give us an example of a technique or exercise that that you like or that they like?
Yeah, let's see. So what's coming to mind now is I recently worked with a young girl. I think she was about 14, 15, something like that. And she had disordered eating. She didn't have an eating disorder. So her disordered eating came from quite severe trauma that she experienced when she was younger. So the way she was very close and her body posture was really close and concave, not much eye contact. And actually her voice was that of a young child. That's the way she spoke. Like she was 5, you know, really. So when we first started together, she wanted to sit on a physio ball. I have a few physio balls around the room. It's quite big.
Those are fun.
Those are fun. See, that's immediate. So that's the immediate response is, oh, okay, that's fun. That's different. Even for someone like her, she's quite closed off. So she sat on a physio ball, and just by sitting with her on a physio ball on her level, experiencing the bobbing, you know, without even talking necessarily to begin with, there was already a connection there. We were already giving eye contact. We were experiencing the same thing, and it was from just an authentic moment. And so that helps build trust and a sense of safety. And I think from then on, we used a lot of art between me and her, and we would, I would offer a really big piece of paper where one of us was on one side of the paper and I would be on the other side. She would choose the art materials and we would still be on the physio balls, and take a pen or a pencil or whatever she wants. And I would offer her, I would support her to maybe not know what we're doing, but just let the pen and paper be in touch and just see, even by just moving on the physio ball while we have the pen in our hand on the paper, and I'm going to do it with her, and we do it together. And when she wants to stop, she just says stop, and then we see what we've made. And we can end up doing that for 35 minutes on the same piece of paper, you know, and that's it. And then maybe in between we talk about what's your favorite color, what's your favorite food, interestingly, what's your, you know, whatever, chit chat, like I said before. And then I would always offer them to have a look at what we've made and put it up and stand up and have a look. And then we would have some reflection. Oh, that's really interesting. You know, what does that look like to you? What does that look like to you? And before we know it, 50 minutes have gone, and we've done a whole session without any kind of structure, really, and without kind of this expectation of it needing to be a certain way, which I think is really important. And I worked with this young person for about 3 months on a one-to-one basis and in group. And the way that she's developed her voice and her body confidence and body functioning became really, really big change. It was beautiful to see, actually. But that's kind of an example just that I plucked out.
It actually, it's a nice example. And it reminds me that when I was in elementary school, I believe, I went to a psychologist, and one of the things that he did is one of us would draw a scribble on a piece of paper, and then the other one would try to make something out of it, like anything at all. And And for some reason, all I remember, I don't remember much about what we did back then. It's a long time ago, but one of the things I remember is that I loved this particular game, and then I would draw something wacky, and then, we would talk about it. And I remember the feeling of like the freedom that, like, there's no rules here. You can draw anything out of this thing. There's no grading, there's no criticism. We could talk about it even if it made absolutely no sense at all. And he would join me in it too. So I felt like, like this was
Yeah.
something that I could do to him, he could do to me. I would draw, he would try to make something out of the scribble that I drew, and then that gave it some sort of
Yeah.
importance or meaning for me, that he was taking it onward. And so it was
Yeah.
this complete a feeling of connection and validation just from a scribble with no words until we discuss it later.
Yeah.
So not the
Yeah.
exact same exercise, but I do understand, I think, the power that these kind of exercises can give, even something so simple, like you said, like just holding the pen above the paper.
That's
And
right.
and yet, we miss that every day. Like, I just think the amount of things that connect us without even talking, like, standing on the bus, and then there's a bump or something, and then you and this other person just kind of, oh, almost go
Yeah.
flying. But then you
That's
look
right.
at each other with a smile, and you've just connected.
Yeah.
Or yesterday I was at the supermarket, and I was asking the employee there, where's the nana leaves? And
Yeah.
he didn't know. But then this young woman came up to me and gave me a bag, and I thought she worked there. And then I made my way to the register, and all of a sudden I see her in the line.
Uh-huh.
And I'm like, oh, sorry, I thought you worked here when you gave me the bag. She's like, no, I just, as I was walking by, I heard what you were asking. And so it was right next
Right.
to me. And
Yeah.
so it gave us the kind of like connection that I just realized, like, she was helping me out of the good of her heart. And we kind of smiled at the misunderstanding and the realization that she was just helping me. And so
Mm.
it's like
Yeah.
the things in motion that are happening all the time, by accident to us, or we do to each other, are all connections.
Yeah.
And we don't really
Absolutely.
allow it. There's too many rules, and you don't talk to
Yeah.
strangers, and you
Yeah.
got to watch the space and everything else, and we just don't have
Especially
that.
now. There's
Yeah,
more now.
especially now. Well,
Yeah.
there's a lot more virtual interactions now, for better or for
Yeah.
worse.
Yeah. That's
Um,
right.
but
Yeah.
I think we don't appreciate the importance
Mhm.
um, of first of all, our emotional needs. Like you said, we all have this need inside, and also to find a way to express it that works for us. And so people just go about their day every day, just
Mm.
with their cooped up emotions, either because
Mm.
they don't recognize their emotions or the importance of giving room to their emotions, or because it's not right to do so. They need to focus on
Mm.
productivity and behaving in the right way, and not, focusing on breathing exercises or doing things that are nice to feel. This is not how we run our lives. And so people, even if they don't develop a major disorder, or end up in the psych unit, they go about their entire lives with this kind of cooped up attitude, or this attitude which doesn't leave room for their emotional needs, not
Yeah.
realizing the impact and the consequences on a day-to-day basis.
That's right. Yeah. And it'll ooze out. It has to come out somewhere. So it'll
Right.
leak out into the body. It'll leak out into behavior. It'll leak out into thoughts. It has to come out. There's only an amount that we can contain within ourselves without it leaking out. It's literally like a leak. It's kind of coming out this way and coming out that way, and you don't.
Absolutely.
Yeah.
I always, when I work with my patients on tolerating their emotions, first of all, I teach them to recognize the emotion through its different manifestations. So like you said, one of those manifestations is thoughts. We all have these wacky, aggressive, weird, sexual thoughts that aren't acceptable, so to speak, in society.
Yeah.
And so we try not to have those thoughts. And then when we have them anyway, we think there's something wrong with us for having them. Maybe it means something about us. Maybe we must really believe this. And so I teach them to recognize that cognitive manifestation. Another manifestation we said before is the physical, how we feel the stress in our bodies, in our stomachs, and our head and our muscles, and sometimes it can contribute to diseases.
Yeah.
Another manifestation is the behavioral, when we're avoiding or trying to be over controlling or perfectionistic or trying to reach certainty or running off to emotional eating, like you mentioned, emotional disorders or drug use. And then another one is that just that cooped up emotion, like you said, it has a consequence leaking out. So for example, I work with BFRB disorders, body focused repetitive behaviors disorders, which include hair pulling, like trichotillomania, skin picking, which is dermatillomania, nail biting, even nervous tics. And all of these problems are actually a result of cooped up emotions. These happen specifically to patients who don't find some avenue to let out their emotions and their stress. They keep everything cooped up inside. But emotion has a purpose. Okay, it's supposed to push us to some sort of action. That's the whole focus of it in nature. It's a survival emotion. Some of the emotions are survival emotions like fight or flight. So it's pushing us, it's creating this energy, this psychokinetic energy. And if we don't release that energy, it stays inside, like you said, and it starts leaking out with a lot of consequences. And yet people on a day-to-day basis don't recognize the need for this emotional expression in all states.
Yeah, absolutely. Absolutely. And that's why the more possibilities to explore and to express, the better. Like the more avenues there are, the more, the more approaches and modalities that enable that to be present and to be expressed is really, really important, because it, as you know, not one size fits all. And sometimes we need more than one size. Sometimes we need a variety of things to help us with the different places where that emotional side of us is being kind of shoved in different areas. And it could be physical, going for a run, but then when we go for a run and we feel that adrenaline kick in and we feel, relieved, then there might be a need for us to kind of understand what just happened, and to be able to kind of bring that into our awareness rather than just going for a run and that's it, right? Maybe there's that. So I really believe that the more modalities out there, the better, really. We don't need all of them, and we need to be careful not to become obsessive about that. But if it's done in a way that's kind of contained and thought through, then I think that's great. It's variety is so important, just like in our taste.
Yeah, like in everything in life, we need a balance of different needs being met. And what's nice about creativity in art is that there's so many different forms, and each one can offer you something else. I know for myself, besides the dancing, there's my love of motorcycles. I'm learning how to take apart and build an engine right now, and my wife is like, what the hell are you doing? But for me, I love it. It touches something inside me. There's photography, which is also something creative about learning how to frame things and bringing yourself to that picture. And I don't know, just sometimes sitting with the cat and petting her, there's something so soothing about that. And so there's all these different things that we can combine, and people don't think to do so. So I think I hope our listeners or viewers can pick up from us how important it is to have time and space for letting your emotion out and finding the creative avenues that work for you. So Batel, if people want to find you, do you have I don't know, social media, website? First of all, you're in London, right?
Well, I'm in Bristol, actually, so that's 2.5 hours southwest of London.
Sorry about that.
That's okay, that's fine. And I have a website. So it is, it's quite a long website. It's www.Batel Magen. So that's BATELMAGEN, all one word, movement therapy. So it's
Yeah.
4 words put together, .co.uk, but you can probably put it on.
I'm going to put it up on the screen because that's going to be a
Yeah,
long
that's a
website
bit long,
domain.
isn't it?
So I'm going to put that up. And then, if one of our listeners or some of our listeners are out in Bristol and they want to try that, and maybe they can.
Yeah. And I didn't touch on my clinical supervision bit of me, but that's also through it's a creative clinical supervision, but that's all on the website.
Excellent. So maybe some therapists will also want to integrate some creative therapy in their work and reach out to you.
Yeah, absolutely.
Well, it's so much. First of all, it's fun to see you again after almost 30 years, exactly, and to catch up a bit. And loved having you here. And for our listeners, once again, if you want to receive updates on new episodes to the podcast or other tools that I release, make sure you subscribe. And for our viewers on YouTube, if you like this video, please hit like. It really helps with the YouTube algorithm. And thank you, Batel, once again. And we'll see you all in the next video.
Yeah, thank you.